You're watching the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know if you're considering liposuction. New body contouring techniques allow for better results than ever, according to my first guest, Dr. David Kang. Dr. Kang, welcome to the program.
Thank you, Randy.
Now, before we get into today's topic, you and your sister, she's also a medical doctor, have a large medical spa in San Francisco.
That is correct.
So who's the typical patient and what are the different procedures you do? I guess she focuses on one thing and you focus on, I guess, the liposuction.
Yes. We have medical spa services in downtown San Francisco near Union Square.
Okay.
And we offer a variety of services, from whole spectrum of, facial rejuvenation to body contouring. She concentrates more on the facial treatments.
Minimally invasive. We've had her on the show to talk about that.
And then I concentrate more on the body contouring, weight loss.
So you like liposuction?
Correct.
I told you on the phone, I said, over the years, I always want to interview people on the new lipo, and they go, Randy, I don't want to be stuck doing lipo all day. But why do you like it?
Because you get to see the result right away. And then most of the clients who we treat appreciate how they feel afterwards. So I think that helps them to transform some of the areas they were concerned about before.
Okay.
And then those areas can be made better, and then when they look better and they start to feel better. So
you do lipo all the time, and I mean you do it every week.
Yes, I've been doing it since Smart Lipo came about 6 years ago.
Okay.
And
Smart Lipo.
Correct. So that was I think in a way, groundbreaking new procedure where you can't do the liposuction under local anesthesia.
Okay.
So since that time, I think it came a long way, because when it first came out, it was just kind of the 6-watt little, small machine, laser power to try to melt the fat. And once you do that under local, you can suck out the melted fat.
Okay.
So since that time, I think, technology,
so it's better now.
Correct.
Now we talked on the phone. You say you could pull more fat now than ever before.
Correct. But not so much, taking out more fat is better. Now I think you have to concentrate more on the result. So taking out more fat doesn't necessarily give you the better results.
So we're talking about smooth results.
Correct. So, now we can use more power to melt the fat. So I think it's easier to take out the fat. So you can use a smaller cannula so that less trauma to the body.
Cannula is what? That's the instrument that you're using?
Yes. So you make a tiny incision to get access underneath the skin to get to where the fat is. So that's when you are able to anesthetize the area with a local solution. And then once you can do that, you can use the laser to melt the fat.
Okay.
So once it's melted, it's easier to take out.
So the transition from general surgery to liposuction and cosmetic procedures, is it more gratifying for you?
Yes, I think it's because you can see the result of the clients who had the liposuction, and you can see some of them. I think the highest gratification that I feel is that some of the clients refers their own family members about getting certain area liposuction, and then you don't have to go under general anesthesia to get this liposuction. Is
lipo the #1 procedure still? Cosmetic procedure?
Yeah, I think besides...
Or is it fillers or Botox?
Yeah, besides Botox and fillers, I think the liposuction is one of the most performed cosmetic surgery.
Now, I know your age, by the way, and you look about 15 years younger than your age. Have you dipped in? I mean, do you do laser treatments? I mean, are you doing these things?
Yeah, when Lisa wanted to try something out.
That's your sister? That's your
yes,
sister?
Yeah, my sister. Yeah, I volunteered one time as a guinea pig.
Okay, okay.
But I think the laser machines are coming out in the market with better technology. So we get to see each year new laser, new techniques. So some of the things we have to kind of make sure what they claim is what's going to get, what we're going to get.
Now I've interviewed your sister on my program before. Okay. who is, if you're just tuning in, we're talking about liposuction today. One of the busiest lipo guys in all of San Francisco
yes,
is you,
I started,
right?
Yeah, about 6 years ago, I was one of the first one. And
You do a lot of lipo. Lipo is your thing.
Yeah.
Now, your sister says, you guys are big on technology. I mean, you have a lot of money invested in the next generation of this and the next generation of that.
Yeah.
Are you that way with lipo?
Yes, I think the lipo, like I mentioned before, kind of started out, low power, but each year seems like they upgrade to a stronger power, 10 watt, 18 watt. Now
and
it's
we're
30
talking
watt.
watts as far as melting
kind of
the
power,
fat.
yes. And then they used to have just one wavelength to target the fat. And then they figured out they can add 2 more different wavelengths to target so that you can have a better skin tightening. Instead of just
nowadays
melting.
you have skin tightening.
Correct.
Well, help me understand that. Why is lipo better today than ever before? What are you able to achieve now that you couldn't do before?
So I think you can do more than what it was intended in the beginning, because we can apply to the larger area where you can remove the more volume to contour the certain areas.
More fat.
Certainly, and then now you have a different wavelength where you can target to do more skin tightening. So make it look much younger, and you can kind of turn the clock in a way where you can tighten the skin so that the results are better.
Who should get liposuction?
So the people who can benefit from the lipo are the people who certain areas like a chin, for example. I have a client who doesn't want to take a picture straight on. I mean, that doesn't like a picture on the profile.
The profile, okay.
Yes, because she has a double chin. So she always try to make herself to hide that, and then she tells me that when even when she's talking to somebody, she wants to kind of keep the head,
Is that right?
so that she she's consciously always thinking about her double chin. So with a liposuction, you can take a tiny incision and then you can get rid of that. So, and then she's one of the...
no more double chins.
No more double chins. And she's one of the clients who refers to, her clients and her families and friends.
On the phone you said that you could do neck lipo and they look like they lost 20 pounds.
Yes, I think that's...
Really?
I did it on my wife too. So
oh, okay.
She has a good jawline, but she has that double chin. It's her dad, has that double chin. So, now she looks pretty younger. So a lot of
the neck, that's a good point.
Yeah,
looking younger, because
yes.
When you're younger, you have a tight neck. Older people.
Yeah. So
starts to set.
And then with that technology I was talking about, and especially on the neck, I think you can do skin tightening much better.
So how do you achieve tightening?
So what I like to do is once you melt the fat and then remove that, I can go further to tighten the skin by stimulating that area with the laser heat, so that promotes your own collagen.
Is it done at the same time?
Yes.
Or do you do remove the fat first and then do the laser?
No, you do it at the same time.
At the same time.
Similar.
And this is a fast procedure, right?
Yes.
For you to do?
Yeah, chin takes about 45 minutes at the most.
Right?
Yeah.
Is it men or more women than men?
Certainly more women are doing the liposuction.
Seems like men need it the most.
Yeah, men, I think, one of the areas that men like to do is the male breast, gynecomastia.
Okay.
So I have
great results there.
Great results because you can really remove and then contour certain areas. So, they're afraid to take off their shirt and then also when they're wearing shirt, it kind of, pushes out, so they hate that. So, once you can remove that and then make it more contoured to the body, then they are more, their self-esteem and they're more happy.
So for these male chests, what's the downtime? I mean, are these people going back to work next day?
Yeah, I mean, couple days? You can take up 1 or 2 days because of, soreness, pain.
But do you have patients that go back to work the next day?
Yeah. If you're just doing the male breast, they can go back to work the next day.
With women, what are the most common areas?
I think the most common area is abdomen and love handle, especially after having a baby. Once that the skin has stretched out, and then certain area, no matter how hard you work and diet, won't respond to that. So those areas, I think you can melt the fat, and then also, like I was telling you, that how to tighten the skin with the improved technology. So I think with the laser liposuction, you can really improve that skin tightening part of it. And then when you do that, you can actually do contouring better. So especially,
is there really contouring, and is there technique to this? I mean, when you look at a woman's abdomen,
yeah,
what goes through your mind, and how much is technique?
Yeah, I think technique-wise is important, because especially when you're doing the abdomen and love handle, I think the most difficult area to do is like around the umbilicus, the belly button area.
Belly button area,
belly button area, because it's not the flat surface, and then you have to know where to melt it, so that how much volume to remove, so that the belly button looks good. For example, I have one client, her request was, when we doing the consultation, "Doc, please make my belly button smile," because her belly button was kind of going downward.
Oh, really? Okay.
Because of her weight and all the skin laxity was pulling down the gravity. So if you can really contour that belly button area, you can make the belly button smile. So I think, that is some of the techniques I think you learn over the time if you do more liposuction. I think some of the other things, you gotta, I think, make sure that you crisscross to melt the certain areas better, because you feel like you did perfect job on one view, and then if you look at from the other side, it's not.
So we're talking about abdomen. So you have to look at the patient in different areas, and you're doing it while they're awake for the most part, but it's not painful.
Yeah, it's under local, and then we can give them some medication to relax them, and they can listen to iPod, or
do they do that? Do they do that?
Yeah, sometimes we carry on conversations, and then we joke about certain things and talk about certain current issues, and I think it's a very tolerable procedure. So, and then I think if you know what to really make it better in terms of how it looks afterwards, I think the clients are
so
satisfied.
You see the end result. So when you evaluate a woman or a man for liposuction, do you see the end result? Do you say, "Oh boy, this is going to be good"?
Yeah, because I think sometimes you have to have kind of the three-dimensional view of how it's going to turn out. Certainly, you first ask the client, what bothers them, and then
what do they say?
Usually, like I said, for example, one client says, I hate how my belly button looks, because it's not smiling. You used to smile. So, and then once from there, you can kind of see why that's happened, because like I said, it's the laxity and then some of the volume that's making that. So if we can kind of look at that and then kind of say, oh, I can do certain areas that can make it better. So you're kind of thinking back of how the client looked before, and then kind of imagine from that.
Do you go all the way around with the abdomen? Every time, or a lot of the time?
A lot of the time, because most of the time the clients have problem with the abdomen is they also have the love handle problem. So if you do the abdomen perfectly, but they're going to notice the love handle. So when you kind of do the consultation, we talk about how it's going to look, because you can do the perfect liposuction in the abdomen, but if the love handle doesn't look good, then overall they're not going to be happy.
Okay,
so,
you do more lipo in a week than many guys do in several months, or in 6 months.
Yeah, that's true.
The fact
I've been doing it about 6 years, and then certainly now, like I said before, I used to do a lot of heavier people, but
bigger patients.
So I used to use in combination of a vaser liposuction, where it's ultrasound based, but that one, in terms of melting the fat more efficient, or debulking the fat volume, I think is better. But I think I learned over time that you're gonna get better result when you do the lipo when you're near your ideal weight.
But you will do the larger patient, right? I mean, after they've tried everything, diet and exercise?
Yeah, certainly. I think now, you know, with the weight loss, I believe that, you know, if you can achieve some of the weight loss first, then you're going to get better results.
Are the patients getting fitter and fitter that are coming in?
You know, some people are achieving that, but I think...
I mean, do they come in better shape, I should say, than they did in the old days?
Yeah, I believe so.
Or they just want certain little areas?
But I think obesity over time is getting worse. So you get to see all these people, but I think they are more conscious about the health in terms of what to eat. And
one thing you told me on the phone is very interesting, I think, that I don't think about, or I don't think anybody thinks about, is that after they get the lipo, they start eating better.
Correct.
Dieting. So it's kind of like leverage for them, for some people to take action.
Clients, kind of kickstart, like you were talking about. So when they have the liposuction, they feel better. So, and then they lost certain volume of fat that's kind of preventing them for doing more exercise. So I think once they have that confidence, I think they can do more exercise and then, you know, get their weight better controlled.
So you could flatten out that stomach.
I think it's not so much the flattening out is good lipo. I think it's more of contour, you know. So aesthetically, I think that's why I think in consultation you kind of have to know what the client is looking for, because I think, you know, just taking out the larger volume doesn't mean the good liposuction.
So good lipo is natural results.
Yeah, more natural.
Results.
Yeah, more. You know, a tightening and smoother, you know, those things.
Okay, so starting at the top of the body, you talk about neck. Neck is a great area. You like that, men and women. What about arms? Arms
are another great area because most of the clients, you know, is genetically one of those areas that doesn't respond to dieting and exercise too. So in the arms, what you can do is you can contour because it's not the flat surface. It's more of cylindrical. So I think there's more...
Is it tougher for you to do the arms?
Definitely more, technically more challenging. And if you can kind of imagine how the arm can be more contoured, I think you can do a better job.
So are there women that on the consult say avoid like sleeveless shirts and things like that because they're very self-conscious of the arms? Yeah,
so I have one client who tells me that, you know, she has an angel wing, you know, because her the arm kind of flaps when you know, she moves around. So in those kind of cases, and then also especially with the arm, you can do skin tightening. So arm responds to a skin tightening better. So I think you can really contour.
In combination with this laser lipo on the arms. So I didn't hear the rest of that story. So this woman with the wings under the arms, as she put it.
Yes. So
what happened? Did she?
So
say
basically, she lost some weight. So the arm volume went down, but the skin part of it is making what's, you know, the wing. So we were able to target that area and then do more skin tightening, so that you can really contour that area. And then once the arm, I think the result-wise, if you can spend more time and then technically more skin tightening, I think you can do better results there.
Okay, now you're doing women's backs.
Correct.
Interesting.
Yes, so that's another area that a lot of clients get really bothered by, because when they wear the bra, the bulges from that bra strap kind of noticeable, you know, through the clothing.
Okay.
So those areas, I think, it's very good to do because it's like more of a flatter surface, so you can really contour that area so that the bulges are gone. So
is that right? So you've done that. Is that a common procedure?
That's a very common procedure.
Do you like the area?
Yeah, I definitely like the back because I think there is not much, you know, it's area that you can really technically do that so that it makes a flat surface.
Okay, so, you know, and today, you know, we're talking about liposuction, new technology. You have the new technology, but it's a lot of this is about self-esteem. I mean, if there's a part of your body, a bump on your whatever, that if it bothers you, it may hold you back.
Correct.
So lipo is one of those things that, for the right candidate, it works.
Yes, I think.
Is that right?
Yeah, I think definitely. I think people are looking to improve certain areas that bothers them. So once they improve that, of course, their self-esteem gets better, and then they feel better about themselves.
What about thighs?
Definitely, the thighs is a good area to do, especially the saddleback.
Saddlebags,
so they have. Mom's thigh, so they know how it's gonna look when they get older. But they had it for a while because it's kind of genetically kind of handed down.
Because there's certain people. I mean, I know a runner, and she's always talking about her saddlebags. Can't really see them, but they're running and running and running, and they can't get rid of a little area.
Yeah. So saddlebag, the bulge. Especially when they wear certain clothes, it bulges out. So, they're very conscious about that. So saddlebags, the volume-wise, I think you have to try to melt the certain parts better because, especially there, you need to contour it. So I think you, spend. So I think sometimes the lipo, you have to be a little more patient. You cannot just go in and melt and
You
suck
as a
out.
surgeon, you have to be very, it's a delicate procedure.
I think especially laser liposuction, I think if you can be more patient in terms of targeting certain areas and then make sure the transition areas are well treated, because you can remove the volume in the middle as much as you like, but if you don't have the transition area well done, then you're going to have a big dimple.
A dimple.
Yeah.
Okay. All right.
So,
now thighs though, but with thighs, like rubbing together thighs. Have you ever had patients where after the lipo they don't rub together?
I think it's also a good area.
Do you go all the way around?
No, I think the thighs, you can target certain areas, and then we're talking about the inner thigh, they hate how the inner thigh rubs, together. So those areas I think you can remove, and then you can kind of contour it so that, their shape is better. And then they don't have enough volume to kind of rub it against.
And you're even doing knees.
Yes. So knee.
Is that really? Is it knees?
Yeah, I think some of the clients somehow that the knee area, inner knee area, when they look down, that's what they notice. So and then especially the inner part of the thigh, you have to do pretty well because that's what they're gonna see. So the outer thigh, sometimes you don't look at them as closely as your inner thigh.
Are you a perfectionist, by the way? Have you been told you're a perfectionist when it comes to lipo?
Yeah, I try to be. I think, like I said, sometimes that laser liposuction, you gotta have a patience to do.
Is that why a lot of other doctors, and the public needs to know this. I mean, I get the inside scoop. A lot of my plastic surgery buddies, they don't like doing lipo.
Yeah, because it takes time.
It's a lot. I mean, it's tedious work.
Yeah, it is a tedious in a way.
But you like it.
Yeah, because I think, if you can have that patience to do the job right, I think you can see it in the results. So the patients appreciate too.
Do you see? I think I talked to your sister, who's also a medical doctor there, that does all of the like a lot of the minimally invasive stuff. But she says that you see people after procedures dressing differently.
Correct. Yeah,
like almost like a new lease on life.
Yeah, yeah. Yes, I have one client that did one area, abdomen. And then after the liposuction, she lost some weight. And then she comes back to do another area, like the outer thigh. I think that makes me kind of feel better because they are the ones that has a good result, and then they're able to come back to you to do another area.
Okay. All lipo is not being done the same way across the country. Correct. Is that right? Does that frustrate you? Because I think the perception is... or what do you even say to some of the critics that say, well, lipo's easy. Lipo's straightforward. Everybody could do lipo the same way. What do you say to that?
If they tried it, I think, technically, I think it's not that difficult. But I think you got to bring that aesthetic eye and contouring, kind of looking at three-dimensional way, and then kind of seeing the result afterwards, and then doing enough clients, following up. I think that makes the liposuction better each day. I mean, each time.
You think you're one of the best guys at lipo?
I think so. I like to believe that.
In the world? Maybe?
Maybe.
Really? Good for you. Good for you. And so you're doing it while they're awake.
Correct.
Safety, of course. And where do you do the procedures? Right there
in our clinic, yeah.
So final message, we're out of time. Good stuff. Final message to somebody that is considering lipo. Maybe they're afraid, they think they're too old, they're too heavy, whatever. What do you say to them?
I think just come in for consult and then find out what your options are. So we can go into kind of more detail about how the lipo is done, laser liposuction is done, and then you can do it under local anesthesia. So it's very safe, and certain areas that you've been thinking about doing it, I think try to find out what are the options, because there are more options coming up because of the technology. So we can go over those things, and then once we kind of go through the options, and then we can.
So
talk
laser
about
lipo.
Less.
So knowing what you know now about combining the laser that melts the fat and traditional lipo, you can't do it any other way?
Yes. I think the laser liposuction definitely is much better way to do the liposuction than traditional.
I want to thank you for coming to the show. Great information.
Thanks, Andy.
Great info. And they could go to your website, find out more. You do all the consults? They meet with you?
Yes.
All right.
And my sister too.
All right. Thanks a lot. You've been watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. If you'd like to see this interview again online, go to our website at wellnesshour.com. You can put in Dr. Kang and send a friend to this interview. Also, on Twitter, if you liked what he had to say or you want to comment about what Dr. Kang had to say, hashtag The Wellness Hour on Twitter and enter the conversation. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.